At the association, we work really hard with all of our families, and we provide a number of services. We provide educational programs for the general public as well as families and professionals. We do a lot with fundraising for the cause. We do a lot with fundraising for research and development. And we also do public policy, which is advocacy for Alzheimer's. There's 5.4 million people in the United States currently that suffer from this disease process, and there is absolutely no cure. So we need to come together and find a cure for this, because every 68 seconds, someone develops Alzheimer's in the US. Together, I think we all share the vision of a world without Alzheimer's. Good evening, everyone. That was certainly very inspiring and very upbeat. I'll try to keep it short for the guys in the back. They seem to be a little grumbly back there. My name is Heather, and I am from the Alzheimer's Association. I'm the coordinator of programs and public policy. So I heard a couple of comments earlier as well as to the state of our political mess, and as you can imagine, I'm quite busy these days. I'm out of the New Hampshire office. Actually, sometimes in location, depending on where you live, the New Hampshire office is a little bit closer to you than the actual Massachusetts office, which is in Watertown. So I wanted to just make sure that all of you knew that we have a couple spots that can meet the needs of everybody. So what I'm going to do is I'm briefly going to go over some topics with dementia and Alzheimer's, and then we're going to kind of echo some of the healthy living pieces that I think all of us should kind of leave with here today. What is dementia? Dementia is not a disease or a complete diagnosis. It's a set of symptoms, and dementia is sort of that umbrella term that we use where Alzheimer's disease is a form of dementia, and there's many different kinds. The set of symptoms that can include memory loss, problems with language and confusion, changes in your visual perception, poor judgment, and changes in personality. What Alzheimer's disease is a disease of the brain. It involves the plaques and tangles that Mary was speaking of earlier, and it is not a normal part of aging. Sometimes that gets a little confusing for folks. We have a great program that is Senior Moments versus Alzheimer's disease. So usually people either get up thinking, oh my God, I have Alzheimer's disease, or they're like, whew, you know, so we go through the steps with everyone. It's also a progressive disease, and we do not have a cure for it. So there's a lot of differences, and I can go through a couple of things. Someone with Alzheimer's disease, they forget the entire experience. Someone who has normal signs of aging, they'll forget bits and pieces of it, but not the entire thing. When I take my Nana out to dinner, she's from the Worcester area, and her favorite restaurant's the Webster House. So if I go on a Tuesday and I take her out to lunch, we go to the same place, she orders the same thing every single time, and then I see her a few weeks later, she's going to remember parts of the experience. She might not remember that we went on a Tuesday, but she's going to remember the fact that I took her out for lunch. Someone with Alzheimer's disease forgets the entire experience, doesn't remember seeing me, doesn't remember us leaving, doesn't remember us going out. So it's clearly two different circumstances. The person with normal signs of aging might remember something later, like a word that's on the tip of your tongue, a name of someone, different places like that. Someone that has Alzheimer's disease has lost that ability to recall that memory. That person's identity is never going to come back to them. So this is very clearly different. Warning signs. We like to talk about warning signs. Memories that change and disrupt your daily life. Challenges in planning and solving problems. Anything that requires a series of tasks. A recipe, managing your checkbook, things like that. Those are very sequenced pieces of a bigger picture. And sometimes folks lose the ability to do that, and those are some warning signs. Confusion of time and place. If you've gone to the same church for 30 years, this is a story that we just had shared with us by a family member. They were a little bit nervous because their mom was gone a long period of time. She's been going to the same church for 30 years, so that's knowledge that she should have. She should be able to go and come back pretty well. It turns out that she was slowly having issues didn't really want to talk to her son about it because she was a little nervous that he would, you know, sort of take away a little bit of her independence. And unfortunately, last week she ended up in New Jersey from New Hampshire. So that's a big issue. And unfortunately, she ended up on 95 South. She entered one of the rest areas on the Jersey side. And she had parked her car there, and she knew enough that she was nervous and that she'd been in the car for a good 4 hours, but she knew she should stop. And fortunately, a New Jersey state trooper was doing rounds and going through the highway and coming back, and he saw her there 2 or 3 times when he had come through. So fortunately, it was the New Jersey state trooper that asked her if she was okay. It's a circumstance that could have gone wildly wrong. And it was a wake-up call for the family to say, okay, she's starting to have trouble. Now, this woman had a GPS, a cell phone, and her son had installed OnStar in her vehicle. And she didn't have the ability to know that those are 3 items that could have helped her out. So we think sometimes that we're doing the best that we possibly can, but we have to be mindful that sometimes we get to the point where we're beyond that. She's beyond that. And that was kind of a wake-up call for her son as well, who wanted her to be as independent as possible, but now we were starting to get into a little bit of dangerous territory. Problems with words and speaking, misplacing things, and losing the ability to retrace your steps, decreased poor judgment, withdrawal from social activities, and changes in mood and behavior. We go over this with families too. If you've had a loved one that every single morning goes and, you know, we have the little group of men who go to McDonald's every morning, they read the paper, they talk about sports. It's something they've been doing forever. And recently, this woman's dad decided that he wasn't going to go anymore. And when she asked him about it, he told her to mind her own damn business. So she said, you know, that's a little out of my dad. You know, maybe I was pushing a little too much, but it seems really strange to me that my dad, A, decided to stop going to something and seeing his circle of friends, and that he reacted and told me to bug off. That's not my dad. So what we discovered was, after talking a little bit more, was the fact that his friends in the group was starting to notice he was having some memory problems. And it was almost a reaffirmation for him that he was having the memory problems, and he didn't want anyone to know. So instead of electing to be okay with it, he elected to not go. And that was a very big change for him, and luckily his daughter was in tune to that. And sometimes not everybody is. So those are some of the things we want to be mindful of. And it was sort of both an isolation piece and a change in mood and behavior. Diagnosis, we really would like people to receive a diagnosis. Mary and I were talking about this earlier and how tough sometimes it can be. There's no single test for Alzheimer's. I can't send you to the doctor to get a blood test or a panel or any such thing that says, yep, you've got it. What we end up doing is we take an interdisciplinary diagnostic evaluation, which is with 3 doctors. It starts with your primary care physician, which, if you're having some memory problems, we sort of have drive-through medical care these days, and anything that you need to really talk to the doctor about, you need to book more than just a normal appointment. We tell folks maybe first thing in the morning or be the last appointment of the day, and request a half an hour if you're concerned about your memory. So that's where it starts. So if the doctor, your primary care physician, rules out everything that could potentially cause memory issues like infections, medication interactions, maybe you're not able to titrate your meds as well as you used to. Maybe you're on a new med and it's giving you some confusion. Those are all things that we can rule out. And as soon as that's ruled out and you're still having memory problems, the physician is going to tell you to see a neurologist. The neurologist is going to do a very, very in-depth plan and a very in-depth testing for you. It's going to be, all kinds of questions and a sort of mental examination, and that will start the process of charting if you are truly losing your memory. So then at that point, you're going to want to see a psychiatrist. A psychiatrist is going to rule out any underlying depression or anxiety that you could potentially be having due to what's going on. So we want to make sure that all 3 are working in conjunction with each other. And then, therefore, you can get the diagnosis. It's about a 90% accuracy rate. because we're going to talk to you, we're going to talk to everybody around you, we're going to talk to your family members, your spouse, your children. We're going to talk about what's been going on and what changes they've seen. And when you get a diagnosis, it helps you plan for the future. There's a lot of different things going on, and we've heard a lot of different speakers today. We've heard about, taking care of your health and possibly, preventing any further loss of memory. We've talked about finances and getting everything in order and making sure that your wishes are what you want. So that's all reason to get a diagnosis, so that you can plan for your future and you can plan for the type of care that you could potentially need and the type of care that you want. Maybe you want to take a holistic route. And does your daughter know that you want to take a holistic route? Maybe you want to stop medications. Maybe you don't want to start medications. These are all things that are sort of a plan of care that you need to put in place. Risk factors. Alzheimer's disease doesn't discriminate. And during an election year, I'm fortunate or unfortunate enough for it to be bipartisan as well. So this is something that affects everyone. And age is one of the biggest factors. One of the issues we have with Alzheimer's disease is you can't prevent it. You can't prevent getting older, or else whoever could come up with that would be a millionaire, wouldn't they? Absolutely. So family history and genetics, we also look at. If you have it in your family, did your dad die of it? You have the great aunt and the uncle, and they all passed of dementia or Alzheimer's. When did we start seeing symptoms for folks? It's an individual disease process, so we can start seeing that maybe in the early 50s and 60s, or you may not see it until 80s, 90s, depending on your lifestyle. Lifestyle is a huge component of it as well. I tell younger generation that I work with, whatever you put into your body, you will pay for later. I'm not saying have everything come to a screeching halt, but everything in moderation is a good sort of rule of thumb. Lifestyle, we hear a lot about different studies that are done, a glass of red wine or, dark chocolate and things like that. So we want to make sure that it's all in moderation. History of a brain injury. Now, there's a lot of different things in the news lately about football players and boxers developing early onset dementia. The newest one that has come to light is John McMahon. He was the quarterback for the Bears. He is now suffering from early stage dementia. He received about 4 concussions that he can remember that were major blows to the head. So we want to talk about that. When your neurologist asks, have you ever been in a car accident? If you're a veteran and you were overseas, were you ever in any kind of percussion injury? Football players, if you played football for Yale, in the 50s and 40s, your helmet does not look like the helmet that you have today. So you could possibly have had injury that way. I have a gentleman who was a boxer in the Navy. And he said, honey, that was so far long ago, it can't possibly affect me now. But he, all through his 4 years, was very active in the boxing circuit. So it does affect his memory now, because even little minor bangs to the head. They're looking at the way children do Pop Warner football now because of this reason. So there's zero prevention for it as opposed to the other disease processes that are out there. So protect your head. I come from New Hampshire, and I suppose this is my little moment to be on my soapbox, but nothing drives me crazier than seeing people pull up to me. Now, I ride a motorcycle. I love my bike. I've ridden motorcycles since I was younger. I race semi-professionally when I'm not doing things like this. So I am protected from head to toe. I race for my dad's team, so he makes sure I'm protected from head to toe. Nothing drives me crazier than when I pull up to a stoplight and I have my helmet, my leathers on, Kevlar gloves, my back protector, boots, everything, and I'm next to a kid in sunglasses, flip-flops, and a tank top on a bike that goes about, it should be a rocket ship, and off he looks at me like I'm crazy. No helmet, zero helmet. And I applaud the right to choose, but choose to wear one. It's your head. You know, one of the most expensive pieces of equipment that I use in my racing is my helmet. And I will buy one type of helmet, and that type only, and it's the top of the line. It's my head. I like it. I like having it on there. I like the way it looks. I like being able to figure out how to get home. So, you know, that drives, and they always look at me like I should be out fighting crime after dark in my suit. But it's, you know, it's one of those things, if we put helmets on our children to ride their bikes, if you have a motorcycle that has 195 horsepower and can launch it to the moon, you probably should wear a helmet and possibly a shirt. Just saying. So, yeah, the flip-flops get me every time. And I have a lot of friends who in full leathers have bonked their heads and can talk about it and be okay because they were wearing the correct protective gear. So the statistics, and here are some scary numbers. Mary had gone over a couple of them earlier today. It's 5.4 million Americans have Alzheimer's disease right now. Every 68 seconds, someone develops AD. Now, with the baby boomers hitting 65 last year, that number is really hugely influxed. We are the 6th leading cause of death, but we are the most expensive cause of death. And that seems to be quite the buzz lately, especially when we're talking about managed Medicare systems and all kinds of different healthcare options that are out there. And so the direct and indirect cost of Alzheimer's and other dementias to Medicare and Medicaid a year in business amounts. Now this is paid. This is not unpaid caregiver hours. This is paid. So hospital reimbursement, nursing home reimbursement, $148 billion a year. If you factor in all of it, the unpaid care, the spouses, the early retirement, the sick days, you're looking at dementia, if it was a company, in the world, it would be the world's largest annual revenue exceeding company. Bigger than Walmart, which is $414 billion, and bigger than ExxonMobil, which is $311 billion. Bigger. And it's only growing because we don't have a cure. And we're living longer. So we kind of need to do something about it. So, we want to talk about promoting your good health. And you guys have heard a lot tonight about eating right, having all your numbers in check. We want to make sure that diet, exercise, and your lifestyle is very well maintained. Now, how many people here do the required exercise amount every single day? Wow. All right. So you're out walking, you're out doing stuff, you're out moving for at least 30 minutes. How many people eat like Christine? How many people eat vegetables and eat the right amounts and they hydrate themselves? And okay, so good, that's good. We're getting better to be a bottled water generation. We want to make sure that, you know, if you're eating correctly, you have a better odds of having a better immune system and later in life sort of developing the disease process. Now, I'm not saying that if you do everything right, you're not going to get dementia or Alzheimer's. I've had folks who, you know, it's that weird, you know, Murphy's Law where the jogger who took care of themselves all life dropped dead in the Boston Marathon. It's the same thing with Alzheimer's disease. You can do absolutely everything right, and you're just predisposed to the disease process. There are people that are predisposed to it, and then it never develops as well. So it really is an individual, case-by-case sort of issue that you have. Mental activity, doing the crossword puzzles, the Sudoku puzzles, doing your recipes. You know, go to Christine's class, learn how to make something. That uses both sides of your brain. Having to follow the steps and actually physically create results uses both sides and keeps you very sharp. Learning a new language, learning a new physical activity, learning how to ballroom dance, or getting out there and doing it again if you haven't. That's physical movement, and it's following steps. Social activity, going out to educational series, volunteering, hanging out with your friends, doing all of those kinds of things is very good for you. How happy you are in your life, it decreases stress, and it makes it better for everybody. So all in all, the Alzheimer's Association I'm not really sure if everybody is clear. A lot of times people think we're sort of just a fundraising entity, but we do a lot more than that. We have programs out there that you can get educated. We do programs for professionals. We do programs for caregivers. We give professional advice to folks going through the disease process. We offer legal and financial help. We can be the voice. We do care consultations. You can come in. Sometimes when someone develops this disease process, not everybody's on the same page. Usually the person with dementia is really not on the same page. So we want to make sure that everybody in the family is. And we can get everybody together and sort of plan out that roadmap for what comes next. And it doesn't matter what stage you're in. It doesn't matter if you're just starting the process, if you have a question about, assisted livings, all of that kind of stuff. Who's the best neurologist? I want a second opinion. Who do you recommend? Where's your list? All of those things we do at the association. We also, we have volunteer programs with us. One of our biggest events is the Walk to End Alzheimer's. I know that there were some last weekend. New Hampshire's were last weekend and a couple of the Boston area ones. This weekend coming up, the North Andover one is a big walk. You can get out there, join, have a team, walk in memory, walk because you want to find a cure. We also have, advocacy is a huge component of what we do. We want to make sure that the funding is there in place, that the funding goes to the correct bodies, the National Institute of Health. We want to make sure that we're promoting Trial Match, which is a huge program run in Boston. We are very, very lucky that we are so close to some of the most happening cutting-edge technology and cutting-edge research so that we can find a cure to this. We have a lot more options. If you want to see a neurologist, you probably have a choice of over 100 as opposed to the rural farmer in North Dakota who has probably 4 hours to drive to one. So please take advantage of these types of programs. What else do? We do a lot of stuff. So advocacy, I split my time between the office in New Hampshire, and I do advocacy and public policy for all of New Hampshire. There's a public policy person that does what I do in Massachusetts, and she just successfully got the Massachusetts state plan passed. So it took a lot of hard work to get everybody on board, but we actually found something that everybody agrees on, both sides of the aisle. It was amazing. It took us a long time to get there, but we got there. Because this disease is coming, they call it the silver tsunami. It is the epidemic of my generation of what we're going to have to deal with. And unfortunately, there's nothing we can do to prevent it. So I want to let everybody know that all of the services here at the association, whether in New Hampshire or wherever, are free. We have a chapter in every state. So if your mom or your parent is in Florida and you're here, we can figure it out. We can make sure that the resources and they're all getting the same thing, same message. Any questions at all, we have a helpline that is staffed 24/7. So it doesn't matter if it's, I'm confused as to where to go for a diagnosis. My doctor's prescribed this med for me. Can you tell me more about it? Or my husband's driving me nuts. And I had a lady tell me today, it was one of the best quotes I've ever heard, husbands, you can't live with them and you can't hit them in the head with a shovel. And I was like, well, let's back up a little, because that whole stress management piece. Caregivers are under so much stress. Our person with dementia, they're just going about their life and living in that moment, and it's everybody else who's sort of picking up and trying to manage around them that usually sometimes needs the stress management as well, and we can do that. So please give us a call. I don't know if there's any questions or anything I can answer. I know that in the research and development component, we are on the very, very edge of 2 very profound and very exciting breakthroughs in research. We're looking at sort of being able to run several different tests and able to screen for folks who are predisposed to have the disease, so we can find out who's likely to have it, which is a huge jump from where we've been, and that's through spinal tap and neuroimaging. We also have a couple of medications in the pipeline that will be able to flush that plaque out. They've really kind of, that amyloid plaque that you saw that was clogging up the pathways. we're going to work on disease management with that so that the medication actually attacks that plaque. So used in conjunction, we'll be able to use it prophylactically and we'll be able to suppress symptoms. And, you know, everybody, you know, there's big lofty goals. We always talk about 2025 being well managed and having a cure for this disease process. Those two components that have come to light through the research and development that we've been doing, a lot of it here in Boston and a lot of it internationally, are so real enough that the Alzheimer's Association on a whole is actually reevaluating how we will radically be changing once those sort of breakthroughs happen. So it's exciting. I hate to be the end person downer and, you know, the 6th leading cause of death, but it certainly is something to be mindful of, and it's great that you guys are out and educating yourselves about this. So thank you. Thank you.